Welcome back everyone for part 2 in our upper body foam rolling series that can help kind of improve some thoracic expansion and really target some of those kind of pesky muscles that tend to be tight and create that tension. In part 1, we focused on the posterior part of the back, so the whole thoracic spine region, that upper middle back. We stayed away from the neck, we stayed away from the lower back, we just focused there. Now part 2, we're going to go back to that position. So we just rolled the back 10 to 15 times. Like I said, if you feel tight or tender in certain spots, spend a little bit more time in those regions. But once we did the part 1, now what we're going to do is put our hands behind our back, and we're going to start once again mid-back or mid-rib cage. And all you're going to do is I'm going to rotate my body onto the side here. So where I'm at right now is right at the middle here, kind of wherever. My lat here, my serratus muscle, my intercostals there, just right in this region. And you're gonna kind of mess around with this position. So I start mid-back, and then hands behind the head, roll over, and just get comfortable. And just, these are gonna be small rolls. Just nice and easy. If you find a spot, which we tend to do, we'll just kind of stay in that region there. And then as you get better, you're just going to roll up and down on the side here. These are muscles that can get tight or sore or tender from your breathing, the change in frequencies of your breathing, or just from your workouts. And we forget sometimes to roll these areas. So part 2 is just 10 to 15 rolls in an area. And once again, if you find a spot, kind of stay there. Take a couple breaths, really expand the air down to that side or pressure, and then kind of move on. So in part 1, we started focusing the full back. Part 2, we rotate onto the side and focus more on this outside or the lateral side of the body here. Because once again, remember, what we're thinking about doing is, how can I use a foam roller to help improve my tissue quality or reduce some tension, whatever you're trying to do, or just recover. And we have to think about the whole rib cage when we're doing this. Okay, so stay tuned for part 3, where we take it one step further and show you how we add some rotation to some of the movements on the side of our rib cage.